Anil, unmute yourself.
Good evening, friends. Welcome to Chetna 10 News weekly show. This week, we are dealing with the issue of stress, depression among COVID patients, COVID warriors. Technical team, if you can show the photograph of Nalin Chauhan. This week started with the very sad news. One of our very good friends, author and journalist, Mr. Nalin Chauhan, his family posted a message on Facebook with a request to come back. I was wondering if a person, learned person, a very well read person can suffer from depression after becoming COVID negative. And he leaves behind his cell phone also at home so that nobody can trace his location. What is the state of affairs of COVID warrior frontline workers? What is the mental stage of COVID warriors? And then we will look for solutions from our panelists, Dr. Priyanka Mahajan, Zahra Kapoor, then Captain Dr. Bendre, who herself is even today a COVID warrior, and Captain Sandhya. Of course, Rajiv wears all the hats and he will share what is the depression and state of affair of the family. So, without wasting any more time, I would like to go to Dr. Bendre. Please unmute yourself, Dr. Bendre. Please unmute.
Yes,
Yes.
yes.
Dr. Bendre, you are front end COVID warrior. You are dealing with the nursing teams. You are dealing with your paramedics. What is the mental stage of your team today? Over to you.
So, yeah, thank you. First of all, it's been 9 months. The entire country and the healthcare workers are working day in and day out in the COVID ward. So it's been mentally very exhausting, even though the duty lasts for about 6 hours. The entire day goes in coming out of the exhaustive work schedule, and because of the PPE kit which we have to wear for all 6 hours, it becomes extremely tiring, and the rest of the 18 hours when we are not wearing the kit, it still becomes mentally exhausting. In the very beginning, lot of us had to go through headaches and other trouble also, because wearing that kit for 6 hours was not a routine for us.
See, this kit, is it not like any other dress? How it is
Sorry.
different from a dress? The
Yeah,
kit,
because
PPE
yeah,
kit.
yeah. So the normal dress we are used to wear it, but the kit is of made up of different kind of a material which is has plastic in it, and also it is covered from head to toe. Not a single part of our body is exposed, including the eyes are covered. In spite of having specs or anything, you are supposed to wear goggles over it. So double eye cover, over that you have mask, then face shields. So it becomes like for those continuous 6 hours, wearing that and working physically also, we have to be active in the ward, so that becomes extremely exhausting.
Okay, okay. Thank you, Dr. Bendre. Now, I'll
Welcome.
go to Captain Sandhya, who is heading Fortis group nursing team of Fortis. Please unmute yourself, Captain Sandhya.
Yeah, done.
Now, we have heard Dr. Bendre about the PPE kit stress caused by PPE kit and all that. What other kind of stress the your nursing staff faces? What is their mental stage after performing duty of 6 hours regularly? Over to you.
All right. Thank you. Am I audible to everybody?
Yes,
Am
yes.
I all right? Thank you. Thank you very much. It's a very relevant question you have put across. The most important thing while we work with the nurses and the nurses who are working, especially in COVID ICUs and the COVID wards, along with those PPE, it's the duty did not extend only till 6 hours. It extended for almost 8 hours, and the night duties with one break stretched up to 12 hours. So, it was very long hours, ranging from 6 hours of minimum and maximum to 12 hours being spent by the nurses in the COVID areas. And here, while I represent the voice of nurses, it's not about my organization for all, those be it in the public sector or the private sector. The most important thing here in this battle was we knew that enemy is there in front of me. We knew who's the enemy. We didn't know how to combat it. So we just tried every measure to save ourselves. And that was the most stressful things to save yourself. Here it was not about defeating the enemy, it is about save yourself first and save my patient. So what it now and the common things will start from the clinical area while wearing the PPE and working there. First and foremost is wearing of PPE. And as doctor said earlier, covering from head to toe, wearing the PPE from head to toe and preventing any source of, plugging every source of air entry or anything inside the towards my body or my body surface. First thing. Second is movements in the body, movements of the body and restricted movements of limbs, walking, writing, examining a patient, say later writing and filling the documentation. It's everything was difficult because they have to wear double gloves most of the times, writing and checking the pulse. Smallest of things like checking temperature and pulse till the big advanced procedures, assisting in the advanced procedures is a very big challenge. Then thirdly, once the duty is over, while on duty, your elimination needs get restricted. You cannot go for water breaks or for go and take attend to your biological needs of passing urine or just visiting the loo or something like that. It becomes completely restricted. And moreover, as the nursing workforce, majority of them are females. It was a big challenge for the nurses who were having their periods, during and passing through their menstrual cycle was again a very big challenge for these nurses, especially in those times in the months of April, May, June, July, where it was hot, it was warm, it was sweaty. Air conditioning units, they do get challenged. And in that environment, with that PPE completely covered and sealed inside that, I would say protective layer, it on the human body itself posed a very big challenge on the young boys and girls, performing duties where they are expected to not to lapse at any point of time, be it for the patient or be it for themselves. And thirdly, this all led to one more important thing, and that was dehydration. Initially, it was good and it was okay, it was adequate, but after the duty and in due course of time, it started posing its challenge in early fatigue setting in the people. And of course, lethargy, or I would say trying to avoid and falling sick. So these were the things were the physical and I would say physiological changes and challenges which the nurses encountered. And this was completely away from the more important, the psychological, stressors, and which was majority of them are young girls and boys and young parents who have got young, very young, small kids at home, either staying in the hospital throughout their COVID tenure, be it the tenure is for 6 days, 7 days, or 12 days away from the family, so that they don't carry infection back. Serve the quarantine in the initial days when the quarantine was like quite significant after the duties, and then going back home. So going home almost after 7 to 10 days was painful for them. Or the people later on when they started going back home after the duties, it literally posed a big challenge on them whether they are not carrying infection at home, because it is not only about the small children at home, it is about the caretakers, which are primarily are the parents, are the parents or parents-in-law who are old. So, carrying that fear, changing, the child comes for, running for their mother or the father and not able to hug the child or to attend to their pleasure and excitement, and rather first rushing to the bathroom and taking a shower from head to toe. Literally was painful. And gradually, now in the ninth month, as Dr. earlier rightly said, there is an immense amount of fatigue which has started to sound, and fatigue and the burnout. So, I would say these are the key things. Otherwise, we can go on and on this. Thank you so much for
Yes, yes.
taking such
Thank
a
you,
very
Doctor Captain Sandhya. Uh, so the first problem which is identified is fatigue. Second is the emotional bond. We have seen photographs of some of the doctors sleeping in cars, not going home. We have
yes,
also seen the photographs of doctors sitting outside home at a
yes,
distance, having tea and watching their children. That hats off to front end team and the team of doctors who have sacrificed their personal life, who have sacrificed their health, who have also sacrificed their comforts to, you know, protect all of us, insulate all of us. I'll
yes.
go to Dr. Priyanka. Dr. Priyanka, what is your experience? Over to Dr. Priyanka. Captain Sandhya, can you
Uh,
please mute yourself?
Thank
Over
you,
to
Anilji.
Dr. Priyanka.
Yeah, thank you, Anilji. So, as we have discussed, as Dr. Anuja has discussed, as Captain Sandhya has discussed, a lot of stress has come from every front. If you talk about frontline workers, they are in a different kind of stress where they're not able to meet their families on a regular basis. The same kind of stress is seen by people who undergo this illness, people who have been having suffering from COVID, and we know that more than a million people have suffered from COVID. So they undergo their own different kind of stress, which is the post. They also started having flashbacks, a lot of fear of again getting the infection, or fear of dying, which we are seeing in patients who are having COVID or who have recently recovered from COVID. Then there is another level of stress in the people who have relatives who have lost them to COVID. For example, I would just give one small example from my clinical practice. So I had a patient who was having panic attacks and anxiety in last year around August, September. So he came to me, he said, I never knew there is something like panic or anxiety. I started him on medications and he recovered beautifully by the month of February. So since it was good time, I told him taper and stop the medications, take due precautions. And he stopped being in touch with me because things were fine. Around mid May, I suddenly get a call from his wife saying, can you please rush to our home? I said, it's not possible, it's locked down, I'm not coming, small kids, and my kid is just 1 year, I just can't walk out of the house. So she said, no, my husband is going to die. I said, why is your husband going to die? He said, no, actually what happened, they were two brothers living in a joint family, both were together, they used to go out for their routine works, and suddenly he got fever, he went to doctor and the brother accompanied him. So this patient of mine recovered from the fever, and when the brother took him to hospital or the doctor, local GP, on coming back the brother started developing fever, and the brother unfortunately succumbed to COVID. So now the patient is in distress, is in stress that he is responsible for his brother's death. Number one. Number two, he was a younger brother, so he lost his younger brother to COVID. And now he was feeling, how am I going to face my parents? How am I going to tell them that the brother died because of me? Though it was not him. So again, he started having a lot of panic, lot of anxiety. He started throwing a fit wherein he was fainting all the time. He was saying, I can't take it. My brother died because of me. All the blame comes to me. So somehow we managed to discuss it. I tried to calm him down. We started him on medications, and now it's been 5 to 6 months. He's doing better. We have been regularly following up, but the amount of stress I saw in him was one of its kinds, which we don't see in the people whose relatives die. But then there is this self blame which comes if someone falls sick, if you are sick and after you someone else falls sick. People who have recovered from COVID are very fearful of being in the isolation wards. I am sure the doctors, the nurses, they are commendable doing their job 24 by 7, and hats off to everyone who's working in the COVID ward. But Anilji, a person who leaves his family and goes to stay in the COVID ward for a period of like 2 weeks or 3 weeks, he sees only astronauts walking around him. There is no physical communication. We have people, we have a psychiatrist, we have a thread, which was circulated, and she suffered from COVID. So when she suffered from COVID, she said that I was craving for human touch. I could not get to see anyone in the ward other than she labeled them astronauts. She said they were astronauts because they were covered in PPEs, and they are also justified in wearing that and going out. So the kind of stress that person goes through who's in the COVID ward at that moment for around 2 to 3 weeks is also enormous. And when they come back, the fear of going back is there because COVID is so new. We don't know whether it will come back or not, whether reinfections are happening or not,
Yes.
whether people are getting some secondary sequelae from this infection. So definitely stress is there at every level. I would say that.
Yes. Thank you, Dr. Priyanka. I remember a very old saying: "Doctor's touch is a healing touch. Once doctor touches your pulse, your 50% of your disease goes away. Once doctor talks to you, 75 along with that 75% of disease goes away. So if the 75% doesn't go away with the astronauts, I can imagine the patient's condition. Now I am going to Zahra. Zahra, what is your experience? Over to Zahra. Please unmute yourself.
Good evening, everyone. So, we'll start with stress. Basically, what is stress? It is a state of mental or emotional tension resulting from adverse or very demanding circumstances. Now, globally, what is happening? There is a lot of stress pertaining to COVID-19, and it is creating a considerable degree of fear, worry, concern in the population at large. And among certain groups in particularly, okay, they are suffering are people with underlying health conditions and care providers, that is doctors. Now, what is happening over here is the patients, they are having lot of stress at an individual level. Coronavirus, they imposed a sense of insecurity and a panic like situation. So here, who is to be blamed? It's the media, the newspapers. They have been updating the information about the rapid rise in cases leading to admission to the hospital, being kept in the isolation ward, requiring oxygen support, being admitted in intensive care units. In this background, when one is diagnosed with coronavirus infection, the diagnosis itself brings in a feeling of shock, a disbelief, a feeling of helplessness, and eventually it triggers a mental breakdown. Let us imagine that we all are locked in a room. So, when we are locked in a room with only basic facilities but no social interaction, as Dr. Priyanka mentioned, what will be our thought process? We will start having this feelings of boredom, loneliness, anger, frustration. So just imagine the patient's thought process. What will be his situation? As Dr. Priyanka mentioned, but obviously he will start blaming himself. He will start having this feeling, why me? I took all the necessary precautions. Why am I restricted to not meet my family members? And he will also have lot of financial concerns like hospital bills, risk of unemployment. This will all trigger negative emotions. I would like to share an experience. My patient, he was having this coronavirus, and the symptoms I mentioned right now, he was going through the same emotional pain. Not only through medications, not only the physical symptoms he was having, but also emotionally, he was quite drained out. He was not ready to accept the fact initially that he's suffering. So we went through a technique which was called GTEC. Now, what is GTEC? Okay, GTEC is first G, that is get organized. T, take a break. E, express yourself. And lastly, C, communicate. Now, getting organized means taking up a small project and completing it with a sense of achievement. Now, you can also bring some changes that you have always wanted, but you never had time to do so. The second thing that we worked was take a break. There are constantly negative news, which is a lot to handle. Decide the amount of exposure to the news that works for you. So, what my patient did, he was in a constant touch with me, and he took this very positively by investing lot of time in updating knowledge, reading books. He invested lot of time in brainstorming. Now, what is brainstorming? We started planning sessions. We started um, thinking that once he is back home, so how will he regain his losses? How he will start life fresh? So, end of the day, the approach was important. The more confident, the better the ability to fight back. Next, what we did was he started expressing himself. Now, his way of expression was through paintings. He started painting as a hobby, but then eventually he started selling it online. Though we shouldn't consider him as a Picasso, but he was still selling it as low as 100 rupees. So the bottom line here is what he was doing, he was making something out of it and he was enjoying what he was doing.
Yes, yes,
Lastly,
yes,
what
yes,
we did was
yes,
connect with others. So now here he started connecting with positive people who gave him the boost, who gave him the vibration to take life as it is and enjoy small moments. So this is how we functioned, okay, when it came to patients.
yeah. We'll come
Very
back.
nice.
I just thought of coining new name for COVID. Completely obnoxious, indifferent, very indifferent disease. C completely, O obnoxious, V very, I indifferent, D disease. So, Rajiv, recently you have had first-hand experience of this completely obnoxious, very indifferent disease. Over to you.
Uh, yeah, Anil, if you remember, Seva City had written a letter to the Lieutenant Governor about 3 months back. I forget the date, but it was somewhere in the month of June or something when the numbers were just going up without any relent, and we were still in lockdown stage when Tarun
Yes,
Sisodia, uh, the Dainik Bhaskar journalist, when he committed suicide at Ames, when he jumped off from the fourth floor. And you knew him, I knew him. We'd worked, we'd always interacted, and I was really fond of this boy, youngster, 35 years of age. when he committed suicide, and we did a program on this, and that's when we wrote to the LG that this disease, as of now, we have a doctor here, we have Captain there, she the nursing from this nursing staff. They all say there is no real medicine. Hit and trial chalte ja raha hai, so that causes a lot of stress anyways amongst people because there's no real protocol which is followed. So that puts a lot of pressure and fear amongst patients once contracted. And that is why we said, you get an appendix, you get admitted. There are people who come visit you, bringing you fruits. Their neighbors, their friends, their others calling up. You have a little fracture. There are people visiting you in the hospital, touching you, hugging you, doing whatnot. So we said the missing link. If our title, our heading, subject line was the missing link in COVID care, TLC, tender loving care. That is what was missing. These humanoids walking around, no touch, no feel, no interaction. Even the doctor is talking to you on WhatsApp. I don't know what is happening these days. Earlier, it was a WhatsApp call. How are you feeling? Oh, I'm not feeling breathless. Okay, then try and do this. Give them an thing. Please check your whether you are taking in the even the nurses in the earlier stage were leaving a glass about 5 feet away on a table, and you are supposed to, you're all weak, you're half dead, you're supposed to reach out or walk across and take that glass of water, and you're supposed to take about, I don't know, 3 or 4 liters of water every day. So how many times you were doing that, and then you have to go to the loo, etc. It was a tough ask for patients, and they're lonely, AC turned off. It's really bad. Coming back to what I'm really talking about is there was another aspect which kills, and especially if you are the bread winner of the family, you're the main earning, main provider of the family. That kills you because the the meter runs faster than the New York taxi. There's no medication happening, nothing happening, but each day a hospital cost. So the recent experience that I had, this was my wife's uncle. He has two daughters, one in US. She flew in. He finally, he flew in when she flew in when he was alive, but uh, unfortunately before she came in. So I drove down here from Delhi to that place to help them out. The other daughter, she was there for 20 days with him, taking care of her. One discussion that we had after after cremation, when in the night we were just discussing, whether we should have taken him to the hospital at all. What did they do there? Nothing. They were blaming, they were cursing themselves. Why did they? Because he was a 77-year-old man, but did not have any single disease. His virus load, through tests, was much lower than his wife. They both got admitted there. The wife had a higher risk factor. She came out in 5 days, 6 days. He was there, and they were in a sharing room. And I think he may have contracted. The other one was he had a lower thing. He was just there. So actually, when in the room, he was taking care of the wife, but she had a higher load, and she was weaker. She When she was relieved, he said, "अच्छा मैं अब ठीक, I'll also get okay." एक रात में उनका 97 के ऊपर से लेके रात में फोन आता है कि he is at 70. No one looked through the night what was happening. No one saw whether he was eating or not, whether he was taking enough fluids inside or not. So जो मैं ये बात कर रहा हूँ ना, the holy cow syndrome that we have had. Yes, your corona warriors, there are good ones. Let's face it, they're good humans, they're bad humans. They're good doctors, they're bad doctors. There are indifferent nurses, there are good nurses. Let's face it, ये जो holy cow syndrome, do say no nothing और सिर पे चढ़ा दो वो नहीं चलेगा. And इन कोरोना वॉरियर्स के बाद द डेवल्स एट द बैक जो मीटर को रन करते हैं, एक पीपी किट, वो बजट आता है उसका 65,000 रुपीज अ डे का पीपी किट का आ गया, बिकॉज एज इफ 10 people came, they all changed 10 times the PP kit. ₹3,500 की जो कि ₹1,000 की धक्का खा रही होती है, all those pressures are 9 lakhs, 8.5 odd lakhs तक bill आया, and we brought back a dead body. So we were discussing amongst ourselves. I said, listen, इस वक्त हम लोग नहीं करेंगे ये वाली पे, क्योंकि अगर हम लोग उनको हॉस्पिटल नहीं लेके जाते, अगर तब चले जाते तो we would be cursing ourselves कि यार अगर हॉस्पिटल ले जाते तो शायद ठीक हो जाता. अब हॉस्पिटल ले गए and they did not care and yet they charged, and वो हुआ. What caught our goat was when we got the bill, and I just scanned through. रात को there is a thali ordered, there is a sandwich ordered, there is a coffee ordered. Here is a patient with that second level of uh, before the ventilator का वो जो oxygen, high oxygen है, totally covered, stuck with that mask and all, BiPAP. उसके खाने के ऑर्डर है रात में. I went back. What the hell is this? Guys, get human. Aapta mein afsar, that our saintly prime minister may have said it, but that did not mean him. Because these are the things which are causing a lot of stress within the society. एक healthy patient जाता है और वो dead body वापस आती है, body bag वापस आता है. And मजे की बात, आपको एक और बात बता दूं इसमें. The saddest part in this, before he got into the thing, he got negative. And we were all happy he's going to come out, and suddenly he's feeling breathless. Which means, because of that shared bathroom, he may have contracted a higher dose from another severe or serious patient.
Yes. Yes.
What are we getting into? So हमारे को जो सारा complete जो है 9 महीने हो गए हैं और अभी हम लोग protocols नहीं बना सके हैं. We can think of a tender loving care. These guys can't.
Yes. 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 I understand, Rajiv. Things are, although it's government's duty to provide health, education, defense, and protection, law and care. Unfortunately, the governments have miserably failed in performing their statutory function,
Right.
and the function has been allowed to be performed by a private healthcare system, by independent doctors. Now, while encouraging private healthcare system, also governments have behaved like builders. I know one thing for sure, that quite a few hospitals have paid hefty amount for purchase of land, and also at the same time, quite a few hospitals have been given land at 1 rupee per square per parcel of land per year. Now, healthcare industry, as I see in various newspapers, private healthcare has become out of reach from every ordinary citizen. And today, that's what I was told, that even cashless insurance is not being accepted by private healthcare organizations, which is causing another serious concern. Now, so far as ordinary citizens are concerned, there is a multi-syndrome dilemma. First is whether I will come out of it or not. If I have come out of it, whether I will survive long, or what is the impact on my other organs. This COVID, completely obnoxious disease, has resulted into multiple organ problems also. Today only there was a study that in 40% cases, heart muscles are impacted. Now, Leaving aside the Apda mein Afsar by quite a few private healthcare service providers, how can we think of insulating the COVID health workers as Dr. Rajiv Sood Dean of RML also had shared that yes, during COVID nobody came to see me. Even the head of the organization is admitted in the hospital and there was no one to take care. We know one thing for sure, this completely obnoxious disease is going to stay. And what it requires is TLC. The way forward, what should be our way forward while dealing with this disease now? Because that is more important because protocols are changing with in every fortnight. Even vaccine. I have my serious concerns about vaccine because the stage at which research started, the virus has mutated itself. It has multiplied many folds. What it does, nobody knows. So, how far the vaccine would be successful or not? It's $1 million question. Yes, media is gung ho about it. Entire pharma industry is gung ho about it because it increases their share value. But our concern today is how psychologically we have to make sure that yes, the patients, the frontline workers do not suffer from this. It's appreciable Zahra's GTech system of bringing out patient. How effectively we can implement in other cases. First, I'll go to Dr. Bendre, the solution passer. Please unmute yourself, Dr. Bendre.
Yes, thank you. So, the solution right now, as Anilji, you said, vaccine is not a final solution for everything because it is in the experimental stage, and we might come out with some side effect profile of the vaccine. It might not be 100% cure also because the research is very short study which is done over last 1 year probably. So the coping skills which we need to we a lot of people have coped it well till now, but we need to cope it and stretch ourselves probably even more because 9 months have passed and we have to just accept certain things and move ahead with those things.
Yes, because we have to now live with it. It is new normal, which is being
Yes.
propagated by everyone. When this new started was clean, the environment was clean, and as we are going on so-called normal activity with industry and all, the nature is again going back to the same sad state. Pollution is again all-time peak. Everything is at its peak, and governments have still not learned lessons. We used to joke that COVID has proven all our studies correct, be it Ganga pollution, be it Yamuna pollution, be it air pollution. For the first time after decades, we saw clean and clear skies, which are again missing. Smog and fog is back. No lessons learned.
That was only during
COVID.
that was only
Yes,
during the
and
lockdown.
we could hear chirping birds, we could hear birds flying in the sky. No, nothing. Now I'll go to Captain Sandhya. Captain Sandhya, after getting out of the dress of astronaut, yes, our skin feels the feel of fresh air, which is not there for 6 hours. And it's a different feeling. When air hits our forehead, it's a different feeling.
Absolutely.
So, how do we, you know, look after our patients, those who come out? In your case, yes, I would like to talk about only the frontline worker, your nurses, your paramedics, those who are working. How to, encourage them, how to bring out those teens from the dilemma and the stress. How to de-stress them, in short.
So, learn the harder way. We tried this. We tried many initiatives. Few of them I'm going to share which turned out to be very productive and useful for us. First and foremost, not only the patients, even the nurses also, those who are multitasking and overworked. They were the ones who had to serve food. They were the ones who had to ambulate the patients or give medication, serve, go round and round, do the work of FNB bearer, do the work of housekeeping, do the work of GDS, and do the work of pharmacists, and also partially do the work of resident doctors by documenting and other things. So these nurses, their resistance has started to set in with the loneliness and the I think there's a lot of noise coming in. Am I audible? Am I
Yes, yes.
audible? Yeah.
I think in between some disturbance is there.
I'll request if people could mute their mics.
Yeah. Let's.
If yeah, I'll request if people could mute their mics. Otherwise, okay. Yeah.
Yeah.
So,
All.
almost.
Anil, you also mute while she's talking.
Yeah, it's fine. It's absolutely fine now. Thank you. Uh, So we tried two, three things I would mention here. And first and foremost was the technology, bringing in technology, permitting phones, and the systems in the wards and ICUs. We installed the, say, for example, one of the commonest one, MS Teams, and the nursing head started to connect with her nurses. The senior nurse very soon, maybe in the second month or so, were put on rosters only to go and talk to the nurses and the patients. Third is because the patient crashes and the accidents were quite high, where the parameters were going abnormal, be it saturation or be it temperature and so on and so forth. So, rapid response team was not that effective when we started creating COVID alerts. Now, not only for the patients, this also started working for the nurses. Reason being, this feedback came from the nurses only who were admitted as patients, that there is nobody to look after and there are nobody to raise the alerts, take care of the alerts. How do we go about it? So through the video screen, that is the MS Teams, the seniors started actually connecting with the nurses on. They were brief, say every 2 hourly, there was a small session on just to recap what has happened, what has not happened. When the shifts get over, then update and interaction again through the screen. They started connecting them and then permitting the nurse. Usually we do not permit smartphones, but now we started permitting so that they can communicate effectively. And then thirdly, in for a particular area, we started the other, they are called as patient care executives, and also a senior person from the nursing administration was started to get rostered, who once a day, in once a time, once in every shift, started going for rounds for a brief period in the isolation room Of course, not taking rounds effectively next to the patient, but being at the nursing station. You know, it it worked wonderfully when there was a senior sitting, when there was only listening to them, or even resolving or taking the phone calls. And not only this, because seniors are certainly more mature in talking to the patients, they were more able to they were able to communicate effectively to the patients also on resolving the and taking their concerns, making the list, and then going out again, connecting with their relatives and explaining to them. So probably communication. I will not say counseling. I will not say uh, bringing relief through food and other beverages or giving them free time. No, it was only one thing which was required there was timely communication and connect. Somebody to listen and somebody to resolve and somebody to connect them to their people. Even night duty nurses, they expressed when they were able to take a break and connect with their families through the phones and all, and permitted with short breaks. So and started to work very well. And of course, last but not the least was allowing them to go home, and incentives. And this incentives not only for the nurses but also for the paramedics who are working and helping the nurses, because these were the two biggest categories, the GDAs, the ones who assist the nurses, the nursing aides and the nurses. So incentives for these two people, apart from timely availability of the senior people and communication and incentivizing, were very, very, I would say, productively for us in combating this situation. And that's how we could actually go back to new normal. And new normal means starting the both the works. The clinicians sitting here will actually relate the COVID and non-COVID workflows, which has started at full spurt, because patients or the people with chronic diseases were not able to stay at home for a long time. They required care, they required medical attention, they started coming back. So this thing started, and rather I would say new normal has forced hospitals also to change their entire all processes and work dynamics to function towards it. That's all. Thank you. You're muted,
Unmute.
Anil.
Unmute.
Ah, so thank you. I'll just share one of my personal experiences going back to 79. When I was young professional, I had joined a company and I was confined to a room to finalize the balance sheet. No incoming calls, nobody to talk to me, because that was my first balance sheet, independently to be prepared. And I used to get a lot of phone calls because I had many friends. So our chartered accountant said, no, let's shift to the hotel, put him in one room, no calls, nothing, only breakfast, lunch, and dinner. Let him prepare balance sheet. So after 9 days, when balance sheet was over, I had to be escorted out of the room because I was unable to walk. That was my situation. So I correlate. When a healthy person like me had to be escorted out of the room where for after isolation of 9 days, despite having food, what will be state of affairs of a patient who is confined to a room in isolation, dependent on drugs, and also looking around, only astronauts around him? What will be his mental stage? I'll go to Dr. Priyanka. Dr. Priyanka, how do you suggest to handle the mental trauma, the physical trauma that patient undergoes? Over to Dr. Priyanka.
Sure. Anilji, as Captain Sandhya has very nicely mentioned that communication is the biggest thing. And with the technology coming in, things have really changed. Now patients have been also allowed smartphones. The staff is allowed smartphone. Tablets are being given. In fact, one of our patients, Dr. Anuja, will also remember, recently was admitted, and he was a psychiatry patient. He became aggressive, violent, and he was at that time detected as COVID. So, though he was a psychiatry case, we had to manage him in COVID ward. And managing a psychiatry patient in the COVID ward is actually the biggest challenge for all of us, because psychiatry patients need a lot more monitoring. We need to inject him when he becomes aggressive. And the main concern was his wife was back in his native place and she wanted to come over but could not come over because he was COVID positive. He would not let her visit him. So I remember one day she called me and she started crying on the phone. At least show me his face. I want to see a photo. खींच के भेज दो कि my husband is alive. I want to know that, because there's no possible way I can contact him. So then I requested one of the doctors who was posted in the COVID ward. He went, he did a video calling with the patient, and when she saw the husband, she was extremely happy to see. So, as Captain Sandhya mentioned, communication is one of the biggest things we always focus on. Counseling, any kind of therapy, also requires communicating with the caregivers or with the relatives or with the professionals about it. Now, as Zahra made her own mnemonic, which is GTAG, the technique she used, I believe in something called ABCDE, the basics of dealing with COVID-related stress. A is for acceptance. So anyone who has COVID or anyone whose relative has COVID, please remember and accept. We all are in it together. You're not the only one. There are a million more people who have had losses, more than a million other losses actually. There are more than that who had, gone through it and have suffered a lot. So accept it that we are in this situation. Don't break down. There are 50% chances you might succumb to it, rather not even 50. There is only 1% mortality rate is what is coming out right now. There are 99% chances that you're going to come out of it very happily. But the stress which people takes, makes their morale down. So they have to realize, they have to accept that they are in this. They have to believe in themselves that they're going to come out of it. If you have faith in yourself, nobody can change your beliefs. So believe that you're going to come out of it. Have a more positive attitude. Hello. Yeah. So
Yes, continue.
yeah. So believe in yourself, accept it, believe in yourself, seize communication, and as Captain Sandhya said, communicate with the people around you, communicate with your family members. People are just keeping it to themselves. As we just talked about the journalist who left the home, it would have been better if you would have made a phone call to his loved ones that, look, I'm feeling very low and I need help. I really need someone to help me come out of that. Communicate with your near and dear ones, because there are people who love you and who are affected by you going away and wanting to take a drastic step so that others don't suffer, but they don't realize the others suffer more when you take such a step. And the last, through our diet and exercise, which is universal for everyone. Have a very healthy diet, do exercises, maintain your physical health. It affects your mental health also. And over and above, please use protection. A lot of people outside now, when I step out of the home, I see them without mask, I see them without anything, because they feel COVID kuch nahi karega. Ask the relatives of those 1% who have gone how fearful it is and how tragic it is to lose a loved one. So the general suggestion is to everyone, please use proper care. It's not gone. We have changed our attitude. We have come to the new normal. At least the doctors and the nursing staff are doing it, but I don't see the normal people doing it, which is an unfortunate state right now. We have to move on, but please move on with the precautions. If we use this ABCD, our mental state, I think would be better.
Absolutely wonderful, Dr. Priyanka. Now I'll come to Zara. With after learning ABCD and then hearing from you GTAC. Now, what is the next degree of solution? How to take care of the depression part among patients?
So basically, what you are supposed to do is, okay, first of all, do things that are in your control. Okay, this is not in your control. Coronavirus is not in your control. You already have a lot of smart and good.
I think your
What are they
voice is
not doing?
breaking. There's something gone
Like
wrong with
voice
your
is,
voice.
yeah.
Zara, just mute and unmute yourself.
Now, can you all hear me?
Yeah.
Okay, great. So, basically, two things that are in your control. Coronavirus is not in your control. There is a lot of struggle that you have to handle at work. So now, what are the things that are in your control? Like listening to devotional chants during your way back home, or whenever you feel low. So this is the best strategy usually when it comes to when you are stressed, when you are depressed, whether it comes to the frontline workers, whether it comes to the patients. Okay, they can just listen to the beautiful chants, beautiful prayers. There is no better way to de-stress by calming yourself through deep breathing, and it's a calming technique for ages, trust me. Mindfulness meditation works wonders. The third thing is walk it off. Little bit of exercise is always essential. A little bit of stretch exercise. If you calm the tension in your body, you will calm the tension in your mind. And to the frontline workers, I want to tell one thing, that you all are doing a fantastic job. You all are doing a remarkable job. Okay, you all are warriors. So even you all need to recharge your batteries. So how will you recharge your batteries? You have to recognize and monitor your own feelings, your own moods. Accept it. Okay, yes, it is there. Okay, then only you will be able to make a change in a patient's life. That's it. Thank you.
Anil,
Thank you for excellent suggestion. I think exercise, yoga, devotional songs, all these go very well when somebody is feeling low. And communication, yes, the communication and effective communication is the biggest tool. Now, with all this, I'll go to Rajiv. Rajiv, with your suggestions of TLC from Save Our City, the government did wake up. That is why this home isolation was encouraged instead of other sources of isolation. How do you suggest that patient's depression, how to deal with patient depression in view of suggestions from ABCD, GTAC from Zara and Dr. Priyanka? Over to you.
yeah, Anil, before I come to patient's depression, give me about 2 minutes on another aspect which I feel is important over here. In my first part, when I spoke, I went after, the holy cows, when we said that there was lack of the hospitals and those people, they were really not caring enough. Now, I want to address another issue, which is the citizens of this country. We the people. I want to address it straight to you. You morons, your Diwali, your celebrations, your wanderlust, your pubbing, your partying, your movement, your carelessness, your absolute take care to hoots attitude towards fellow citizens brought this about, because all the data shows that our curve was going down, and come November 1st, we approach Diwali, the shops open and the curve went. We know that Delhi went from 1700 to 7500, and it is back to down to 3,000, 2,500 down there. So who brought this upon themselves? I was critical of the government. I am way more critical of you morons. Why would you put so many people at risk? Now Christmas is approaching. New Year is approaching. Would you still do that? What you don't understand, you youngsters, when you are partying, when you are the healthy lot, when you move out, you bring in you put your parents at risk, you put comorbid patients at risk. It is, I can say, the past month, the November to December till now, it was brought in by us. You can't blame the government. I will blame the government. I'll continue to blame the government because government did not act and put in some restrictive lockdowns of some nature, restrictive movement, odd even, close some markets, open some markets, bring in some protocols for operation. You remember another letter that we wrote to the LG and the Chief Minister, where we told them that everyone who wants to indulge in an economic activity involving public contact or public interface, they must carry a COVID negative certificate. Because if I go out, I will spread only to 5 or 6 people that I come in contact with if I'm a carrier. But if one shopkeeper or if one street vendor is a carrier, he's a super spreader. One person will spread to 200 in a day. And that is exactly what happened during Diwali. And that is exactly what would happen if the government now doesn't impose such restrictions that you can't allow every activity around the thing. Now coming to your basic question. Listen, we have talked about things. We have been writing letters. We've been saying things to people. But one thing that still bothers me is that this is a pandemic. You have a law. Why should citizen be paying for his treatment? पोलियो के लिए सिटीजन पे कर रहा था क्या? चिकन पॉक्स के लिए स्मॉल पॉक्स सॉरी वो यहाँ चिकन पॉक्स की वैक्सीनेशन जब होती थी सब कुछ था उसके लिए सिटीजन पे करता था. This cost has to be borne by the government. But then we have a Maharaja style government with a rishi sitting in the chair, and they think that they're the ones doing everything through their ads. They've left the citizens to their own to fend for themselves. You yourself said now cashless transactions are not happening. All these are causing stress. So government still, because this infection or this virus is not going anywhere. We will be talking about it in June 2021 also. Let me tell you that. So we need the government to be way more proactive, bring in cost restrictions. Private people have to make money, but then there should be bans. Because anyway, they are not providing you, they're hitting in trial चल रहा है, ये भी करके देख लो, ये भी करके देख लो, ये भी करके देख लो, कुछ तो चल जाएगा, कुछ तो है. I know कि मेरे से ज्यादा अच्छा एक डॉक्टर मेरा ध्यान रख लेगा, but still, let me tell you, they're quite clueless as per the reports that we have seen. That's all I have to say. I'm really sorry. I was gruff. I was rough to everyone, myself, to my citizens, to doctors, to the PM.
Yes. Thank you, Rajiv. I think before we run for concluding remarks for 30 seconds, I would like to share the governments are today not run for the people, by the people, and are not of the people. Now the new word has come, government of the few, for the few, by the few. The governments are carelessly spending on advertising instead of doing groundwork. They feel publicity is more important than actual work. The kind of amounts that have been spent on publicity could have been spent on healthcare. The amount which is being spent for unnecessary projects could have waited for some more time. The money could have been invested in healthcare system. The so-called planners of the country, they did plan parking of government dispensaries and government hospitals in various colonies, but those neither the hospitals or dispensaries do not exist in those colonies. The governments have turned to builders. They are no more infrastructure health providers. They auction the land. And today we have a cream of about 30,000 bureaucrats, 5,000 MLAs, 748 MPs, and 200 plus business families. So put together 35,948 elite class of the country, and rest 129 crore 99 lakh 99,052 are left to the mercy of God. I fully agree. Yes, by making statements on television or mic or screen, nothing else is being done on ground. So, coming forward now, we'll have Christmas also, we'll have New Year also, and we had Gurpurab also. Last year, Gurdwara Prabandhak Committee said no crackers on Gurpurab. So similarly, this year also they are quite sensitive. But we have in the society people claiming religious suppressions. They'll start saying, "Oh, only on Diwali, why you allowed it? Why you are not allowing Christmas? Why you are not allowing New Year?" So we have to get out of this mindset also. That today my liberty can be fatal to my family, to my parents, to my children, to my neighbor. So my liberty is to be restricted by me only, not by law. There cannot be every situation under law. As society, we must understand our duty so as to not to stress the already collapsed system. So we have to take care of ourselves. And yes, if by chance anyone becomes victim, then we'll have to follow GTEC and ABCD. We have to go back to the school of our life and start unlearn everything and again learn everything new afresh. So with this, I'll request 30 seconds your concluding remarks, starting with youngest Zahra. Over to Zahra.
I know, okay, this is a very critical time. It is a critical time for everyone, but together we can win everything. So let's come together. Let's help the doctors. Let's help them so that there is no rise in cases by taking precautions, by putting masks wherever we go. Let's unite and let's fight it out. And let's say Corona go away permanently.
Thank you, Zahra. We can't say Corona go away like Ramdas Thawale said. Now I'll go to Captain Sandhya. Over to Captain Sandhya.
So before we sign off, I'll leave you with my final message. When in distress, call. Call anybody whom you trust. Call anybody whom you love, and call anybody whom you think can help you come out of it. Don't sulk, and please don't stay quiet in the corner. This is very important. Beat corona or no corona. In distress, seek for help. Don't stay quiet. Take care of yourself and stay fit. Thank you.
Over to Dr. Priyanka.
Yeah, so the last thing is, as we mentioned, it's high time we all consider that the medical fraternity needs to grow further. We need to invest a lot in, building up the medical system. And the second thing for the normal people is, please don't stigmatize anyone who has COVID, who has lost someone to COVID, or who's currently undergoing COVID. Please don't stigmatize them and throw them out of the society, telling them nobody, will talk to them, or, outcast them from there. Please support them. Even a message stating to those people, we are with you. If you need anything, please call us. Makes a lot of impact on the person whose family members are going through it. So don't stigmatize. I have seen a lot of people saying, "अरे उसके घर पे कोरोना है, उधर नहीं जाना, उस फ्लोर पे नहीं जाना." At least you can call them and talk to them for 5 minutes. As said, communication is important. Don't stigmatize to people who have. Tomorrow you can have it, your relatives can have it. So be together in this time of need.
Thank you, Dr. Priyanka. Over to Dr. Bendre. Dr. Bendre.
Yeah. So, as Dr. Priyanka said in the previous time, that wear a mask. That 10 minutes of time when you're going out, if you can wear that mask, a healthcare provider, a frontline worker like us and Captain Sandhya's team, we have to work for 6 hours. If you remain like that for 10 minutes, imagine our condition. And if you can just cover your face with the mask for 10 minutes when you're out, we would get relieved from our duty quite early. If that helps us a lot.
Yes. Yes. Over to Rajiv.
I will take Captain Sandhya's word very seriously. I, for one, if in distress, I'm going to call, and believe me, I have 5 people on this panel itself who I can call, and they're all experts. So I'll take it from there. And a message, I'll take it forward what Dr. Bendre just said. There they are, 1, 2, 3, 4, 5. There you are. So all of you, I'll make a call. But one thing, yes, what Dr. Bendre just in a final conclusion, I think I'd definitely say mask, distance, wash. These are 3 precautions if you were to take. That's good enough. You don't have to do it overtly, that I've checked. I don't have to be, constantly washing, no. But reasonable life में करो, आप अपने careful रहोगे, and stop being fidgety. Just keep touching here, there, ये क्या है? That feeling, like I used to do. I go to a counter, I go lean there. So you got to keep that distance.
Yes.
So if you could avoid touch, that will be wonderful, and that'll make at least the ladies very safe in this country. With COVID, one good thing, if we learn to stay, standing in a queue, if we learn to keep a distance, believe me, it's going to be a great thing for this country. Finally, we would have learned to keep our distance. So that's all I have to say for now. Unmute yourself. Anil, we can't hear you.
Thank you, Rajiv. You have to keep reminding me. I don't know. I'll have to learn this also to be active and be attentive towards my mic. Thank you very much, Dr. Bendre, for your excellent views. Thank you, Captain Sandhya, for sharing your views. And Zahra, grateful to learn about your GTAC. And Dr. Priyanka, thank you very much for your ABCD analysis. Stay tuned for a while. Once it is the live telecast is over. Thank you very much. We can now, I think we'll get in touch again